Hi, this is Dr. John Nieters again, and I'm here to speak with you on, I guess it's April 15th of 2020. We're still in the midst of the pandemic, and I'm going to do something that I've never done before. I regularly get asked by patients, what do you take? Right, John, Dr. John, what do you take? And I tell them it's irrelevant, right? I'm going to prescribe what's best for them, and that may not be what's best for me. But during this time, there's so many people asking these questions that I do want to show the products that I take. Knock on wood, I have not missed a day of work in 37 years, so I think what I'm doing as immune supplementation is pretty good. So I'm going to show you what I take. I'm going to talk about them briefly, very briefly. I will at some point go into more depth and we'll have a little longer time together. But today I'm just going to hit the high points and why I take what I take. Now, keep in mind that I'm doing a modified ketogenic diet. I'm not really trying to get into ketosis, but I am eliminating, particularly at this time, all white foods, other than cauliflower. So the reason for that is I want as little free sugar floating around in my bloodstream as possible. All microorganisms love sugar. So I recommend, I'm not saying you should go into ketosis, but I do recommend that you get a lot of protein, a lot of good quality fat, and massive vegetables in general. Now I have patients that do really well on a carnivore diet where all they eat is meat. I have patients that do well on vegetarian diets, so they're not eating any meat at all. So this is not a blanket recommendation. I'm just telling you what I do that apparently works for me. So the things that I do every day, since I'm doing a modified ketosis or modified ketogenic diet, I do 4 meals a day where I get 20 grams of protein or more. Now, I really can't eat that much. I'm not that hungry. So I do 2 of those meals as shakes. So I'm going to show you the products I use. I actually just counted, I have supplements and from 27 different companies, so I'm not locked into any particular company. However, for today, there's one company that's going to predominate because they, in my opinion, kind of predominate in this particular area. Now, with that being said, there are many, many great companies out there. Like I said, I buy from 27 of them. So I do a product called InflammaCORE. InflammaCORE is used to reduce inflammation, as you might guess. However, it also has 15 grams of protein, and it has reacted zinc, which is very, very important in my mind. So I do this with almond milk for 1 meal of the day. For another meal of the day, I do something called MitoCORE, and MitoCORE is really aimed at the mitochondria, the energy-producing cells of your body. If your mitochondria is not working, you're toast. When it comes to something like a pandemic, the fatigue would be enormous. And heart problems, which are the major issues actually with the COVID-19 infections, we talk about the lungs, but really the heart disease part of it is the biggest killer during, and it will be after the pandemic. But I'm going to do a separate talk on that. So this also has 15 grams of protein, so that's close enough for me. So I will do these about 3 hours apart, and then I'll do a small other meal, leftovers from last night or hard-boiled eggs, and then for dinner I'll do kind of a full dinner of a lot of vegetables and protein. I also do ghee and MCT oil in my tea in the morning. Cream is actually highly insulinic, it increases insulin, even though it doesn't increase glucose very much. So I've switched from cream to MCT oil and ghee, and I have a lot more energy. So none of the products that I'm going to show you do I make or have any interest in, other than I do sell them. Now, those I do every day, as well as this product, which is buffered lemon C powder. To me, this is the one thing I will not go without. Now, we use it a lot for bowel regulation, people that are constipated, because it will give you a good bowel movement if you take enough of it. However, I use it because it has 2,000 milligrams of vitamin C, or 2 grams. Vitamin C is one of the keys in China to healing people from COVID-19. They're getting usually up around 20 grams a day of vitamin C as an IV. as an infusion. So most people can't do 20 grams a day of vitamin C because they get horrible, horrible diarrhea. So max out your vitamin C to the point where you start getting loose stools. And that's different for everybody. Also, this has a large amount of magnesium in it, and magnesium is critical. Magnesium deficiency is rampant in the U.S. I would guess 85 to 90% of our population. And if you look up magnesium and the things it does, you're going to see a list of about 40 things that it is critical for, including heart rhythm issues. Also, it has potassium. They're finding some of the early studies that people that were dying at a higher rate from COVID-19 had diminished potassium levels. That's probably because of the angiotensin converting enzyme 2, or ACE2, attachment of the virus, and that's causing potassium loss. I'm not sure that that's why, but that's my guess. At any rate, keep your potassium levels up. K-Force, the #1 antimicrobial and particularly antiviral on the planet, is vitamin D. Anybody that tells you otherwise, there are thousands, literally there were 2,000 studies in 1 year showing the power of vitamin D at controlling all illness and injury. Low vitamin D status leaves people open to everything from diabetes to heart disease to MS. So this is critical. I use this particular form because it also has 180 micrograms of vitamin K. And the vitamin K is important. If you don't have it, the D, which activates calcium, it doesn't direct it. And so it can go into the arteries rather than the bones. With vitamin K, it destroys it, keeps it from going into the bone, from the heart, and it will direct it to the bones. So it's always critical to take those together. Doesn't mean you have to take them at the same moment, but you should be taking both. Also, benfotiamine, which is a very, very underutilized product. So benfotiamine is a fat-soluble form of thiamine. This is the #1 thing that I use for neuropathies, peripheral neuropathies in particular. It is very highly involved in nerve health, but also it's been used in studies to prevent and reverse sepsis or infections in the blood. So that's my core daily regimen. Then, at this point, I'm loading up on what are called TH1 stimulators. The immune system is incredibly complex, massively complex. However, on the simplest levels, we have the TH1 system, T helper cell 1, and the TH2 system. In most autoimmune diseases, one side is too strong and the other side is too weak. Now, that can vary depending on the autoimmune disease. So this information that I'm giving you is absolutely not as your medical provider because I haven't examined you. And the only way that I could do an accurate job of prescribing would be to know a lot about your immune system. So for me, I'm taking a lot of TH1 stimulators because I don't want to get the viral illness. There is some thought, not evidence yet, but some small thought that if your TH1 system's too strong, that might throw you into overdrive. But I feel that it's more important to do this. Now this is something called Immunitone Plus, okay? Immunitone Plus, and it has TH1 stimulators, and most of you will have heard of these. These are what you will usually see in cold products, etc. So it has Echinacea, Astragalus, elderberry, and green tea extract. So those are TH1 stimulators. It also has Andrographis, and that's a key addition because Andrographis is one of the 2 most powerful herbs in Chinese medicine for reducing overimmune responses. So this can help keep the interleukin cytokine signaling systems under control a little bit more. So it's a key ingredient in any TH1 stimulator. And then there are 5 different mushroom extracts. The mushroom extracts are more immune modulators and not just TH1 stimulators. So this has Reishi, Maitake, Shiitake, and Cordyceps, and it has some lauric acid, which kills viruses. So that's specifically viral. I also take extra green tea extract. Now, shifting to a different part of the immune system, Lining the mucous membranes in your respiratory tract, and actually all through your mucous membranes, are cells that create and release a substance called secretory IgA. Secretory IgA. And just grossly simplistically, secretory IgA goes out and grabs the virus, bacteria, whatever the offending molecule or antigen is, and it carries it out of your system. If I look at 10 people's secretory IgA levels, particularly in their gut, and they're all going to Mexico, I will bet money that the one with the lowest secretory IgA level is the one that gets traveler's diarrhea and gets sick. So this is important for anybody that's under high stress or anybody who has been ill over the last few months, because when you're ill, it depletes your secretory IgA levels and you need to get them up. Now, specifically antiviral, so these are all general. Specific antiviral, I use two products. One is called Viracid, which then has additional vitamin C and zinc, which again is absolutely critical. So many of you have been following the COVID-19 and you're seeing stories about hydroxychloroquine or Plaquenil and azithromycin. There is very good science, very strong science behind the idea of using those together. The gentleman, Didier, I don't know how to pronounce his last name, Rout, from France, is a world-famous epidemiologist and infectious disease specialist. He didn't just pull these out of wherever. Azithromycin has been shown to reduce infection in children who have repeated respiratory infections that then go to lower respiratory or lung infections. It's been shown to reduce that by about 50%. Really important stuff. And it does that by modulating a particular cytokine, or actually interleukin 8, which is unimportant to you, but very, very important. It then has many of the same antivirals that are in this, but I like to double up on that. It also has lysine, which is an antiviral. Also has the Andrographis, which is important, and just a few other immune stimulants that are specifically antiviral. And then this, Yin Qiao Plus. A bottle exactly like this lives in every room of my house and is all over my clinic. My son, since he was 6 years old, knew that if he started to feel like he was getting a sore throat, he would get up in the middle of the night, squirt this in his throat, and it's amazing. It's a very, very powerful Chinese herbal supplement that is exceedingly safe. There's the ancient formula Yin Qiao San, which really wasn't strong enough, and so they added 3 additional herbs to that, which are very, very powerful antivirals. At Christmas time, my patients will buy 10 to 15 of these to give out to their friends and relatives as gifts. It's great stuff. Then, on a different way of looking at things a little bit, there's a product called D-HIST. This we primarily use for allergies. It has quercetin, bromelain, stinging nettle, and a few other things, and it specifically lowers histamine levels. Well, that will help reduce inflammation. Also, a methyl B complex with high-dose vitamin B12 as methylcobalamin, and as methylcobalamin, and high-dose folate is 5L-methyl tetrahydrofolate. This is just, B vitamins are where you get your energy from. No B vitamins, no energy. Now, that's the kind of the general thing. Now, personally, I've had cardiovascular issues for about 40 years, and so since the #1 killer with the COVID-19 is cardiovascular problems, by far, actually, it's way ahead of everything else in terms of comorbidities of people that present at the emergency room. So this is what I personally take for heart issues. I take very, very high quality CoQ10. This is a very special blend. You really want to look very carefully at your CoQ10. Some of it's worthless. Ubiquinol is generally the preferred form. This is high performance. I then do something called ATP 360, because this is, again, I'm not going to go through everything it has in it, but there is, again, repeats of a lot of the things here to to get my heart mitochondria pumping. Remember, your heart is pumping non-stop, you hope, for a very long time, and you're running 60 to 90 beats every minute for your entire life. That requires a constant reloading of nutrients into the mitochondria to keep that happening. And then, of course, Orthomega, in this case, very strong, very high delivery rates of EPA and DHA. Now, the reason I'm showing you the products I use, one, just so you can see, get some ideas, but also so that you know you want to invest in good quality supplements. Bad supplements are worthless or worse. Good supplements, that basically there's no danger. I don't know how long it's been since there was a death from a vitamin or supplement, but every year I have checked the statistics, the number is 0. So we're looking at tremendous safety. Now, that being said, since I don't know you, I don't know how many of these are going to interact with your medications. I don't know if you're TH1 dominant. I don't know if you're TH2 dominant. So take it all with a grain of salt. I'm just saying this is what I take. And then because I tend to form cholesterol in my vessels, I do an aged garlic complex, because aged garlic is one of the best things to remove soft plaque. Once it becomes hardened and calcified, not very effective, but soft plaque is great. So there you are. These are all things that are available. You can contact my office if you wish. I will not diagnose you over the phone, at least not at this point. Those guidelines may get lifted, but they have not for acupuncturists yet. But see your provider, see someone that you trust, and by all means, when this pandemic is over or at least slowed down, get into your alternative care provider and get labs done to check for heart inflammation. That will be the biggest killer to come out of the pandemic. More people will die of heart attacks. This happens every influenza season. And so get in and see your provider, get some inexpensive lab tests done, and if you have inflammation, get rid of it quickly. So, thank you. I appreciate your tuning in, and join us here at the Balancing Point whenever you have a moment. Bye-bye.